Hi, my name is Lizette Cadwallader, and I wanted to share with you some of my experience that I have with challenging behavior in schools. For a while, I practiced ABA therapy, which is you work with kids with autism specific, and I did school psychology. In both positions, I experienced a lot of behavior. A lot of it was aggression, both physical and verbal aggression. I was hit, kicked, spit on. I experienced a lot of verbal behavior and was called a lot of inappropriate names. I had chairs thrown at me and whatever the student could basically get a hold of. And luckily, I was never in any danger or where I felt that, any kind of restraint was necessary. And that's something I'm very grateful for. A lot of the time, these experiences were, like I said, with children that had an autism diagnosis. Sometimes it was kids that had ADHD, had emotional disorders, had oppositional defiance disorders, and it was just a lot of different bipolar disorder. And it was a lot of issues that were just being displayed in the classroom that obviously were not appropriate, and a lot of factors that obviously come into play. Internal factors and influences in the behavior. It's basically what the student brings in with them, something that could be going on at home, a loss, divorce, and a lot of the times it was these kinds of issues that I did see when behavior was very extreme and we could not get that communication between each other. It was a lot of internal influences that were being brought from home, unfortunately. And the external factors, I think this is characterized by situations that are specific to learning. So a lot of task avoidance, a lot when people are having difficulty with a specific subject, and if they need attention or they need to more intervention or help and they can't ask for it. And that's what influences the behavior a lot of the times. My experience with situations where behavior was taken care of appropriately in the classroom, where a lot of evidence-based practices were adapted, was in my experience in school psychology. For an example, social skills is a big issue with behavior and something that we need to teach our students because it's a life skill. And during my practice of school psychology, we actually put together a social skills group that got together once a month to help kids that had a disability interact with kids that were typical. These handpicked typical students would come into the classroom at lunch and help their peers with social training, and I believe it was called social skills management. And they would interact, usually with structure, data was collected on behaviors, and they worked on just appropriate interactions with one another. And through the social skills training, they were able to interact, and they were able to have reciprocal conversation, and it was actually a really great experience. I felt that for it having been just initiated that year, it was very productive for the students, and it did help students feel more confidence. And I'm not sure if it necessarily helped the behavior drastically, but I was able to see some confidence in kids and their social skills, and knowing that they are able to maintain these relationships, which for them is a big plus, because sometimes that's what's causing behavior in class. Another example is through counseling. I was sometimes called into classes where there was problematic behavior occurring in class. And in one instance, it was a student who was being assessed at the time, and there was a lot of noncompliance, a lot of verbal inappropriate verbiage to the teacher. And I think a lot of the time the teacher is the person that has to practice teaching the skills of self-monitoring. And the teacher did a good job, helped the student be able to self-manage their emotions and their interactions. And through a reinforcement that was already in place in the class, she used the reinforcement of a coin token, and the student was able to de-escalate. And luckily that time I was just there to observe and didn't have to put myself in the situation, even though the teacher felt she had needed me and had called me there. But through all this reinforcement and positive self-managing and self-monitoring and de-escalation skills that they had been working on, everything turned out good. And those are a couple of examples of when I've experienced it. Something that I wish that was done differently is when students are in a classroom and the teacher can't deal with the behavior, so their first way of dealing with it is to send them away. I very often saw this where teachers just didn't want to deal with it and unfortunately called me, called the principal, called anyone that they felt could handle the situation, I guess, better than them. And I would just wish that teachers would take a little more initiative in trying to implement interventions or strategies to help their students in their class and just adapt skills that they can use to, manage themselves, to help manage them, and instead of just basically putting kids in timeout instantly. Thanks for listening.